Hello everyone, my name is Dorothy Estrada Tank. I am member and currently chair of the UN Working Group on Discrimination Against Women and Girls, one of the 3 human rights mechanisms foreseen specifically for the protection and promotion of the rights of women and girls, together with the CEDAW Committee and the UN Special Rapporteur on Violence Against Women and Girls. Thank you so much to the organizers for this invitation and for the opportunity of presenting on moving from a militarized prohibition to intersectional inclusions to a feminist approach to drug policy as the central topic of this event. Now, we know that globally 1 in 3 people who use drugs are women. We also know that women who use drugs face higher levels of stigma and discrimination and more difficulties accessing harm reduction programs, drug dependence treatment, and basic health care. We also know that women who use drugs are disproportionately affected by criminalization and incarceration, with 35% of women compared to 19% of men in prison worldwide having been convicted of a drug-related offense. The war on drugs has been found to have a discriminatory and disproportionate impact on women, and this undermines women's health, their well-being. It wastes public resources while failing to eradicate the demand for illegal drugs and the illegal drug market. And militarized prohibition policies are often gender blind, and they also have far-reaching implications for the widest range of human rights of women. Sadly, to this day, women's specific issues and concerns remain largely invisible and neglected in drug policies and programs, as you will have seen in this event. Now, our working group, this expert group of the UN Human Rights Council, has demonstrated that drug policies cannot be effective without addressing the root causes of systemic gender inequality and discrimination. We know this also from our consultations directly with women that are affected by these drug policies. And we have particularly found some points that I wanted to share with you. One, that the stereotype standards of women's moral conduct play a role in disproportionate female incarceration for drug-related crimes, as women are judged more strictly than men. Second, that stereotype notions of what constitutes good motherhood aggravate the disproportionate criminalization, detention, and confinement of pregnant women who use or are suspected of using drugs, and they frequently risk imprisonment for attempted abortion, miscarriage, or harming the baby when using drugs during pregnancy. Outside the justice system, pregnant women suspected of drug or alcohol use can also be involuntarily detained and forced to undergo medical treatment, often without sound medical evidence that they have a drug dependency or that the fetus is at risk. We have also found that reduced job opportunities coupled with a lack of social protection is one of the major reasons for women's involvement in drug trafficking and in the resulting criminalization. We found as well that women's economic subordination exposes them to being associated with or blamed for criminal acts committed by family members, in particular by their male partners or spouses. And we know, for instance, that many women are incarcerated for having drugs in their homes when the owner is really the partner. We know as well, going to this, let's say, identification of challenges and obstacles to overcome, that the exposure to gender-based violence, including domestic violence, may increase women's contact with the police and thus their risk of criminalization. And this is particularly true for women identified as criminals in the first place, such as those who use drugs or are involved in minor aspects of drug trafficking. So as a result, women who face violence may often be reluctant to contact law enforcement out of fear for further violence or discrimination against them, and therefore they remain in a cycle of oppression. So violence is also frequently used as a tool to coerce women who become involved in drug trafficking networks, where they are used as mules or treated as dispensable by the leaders of these criminal groups. Moreover, women who experience multiple and intersecting forms of discrimination are disproportionately affected. We know that systemic racism places racial minority women at a heightened risk of involvement in drug trafficking, even at the lower levels of drug networks, and also higher risk of incarceration. Indigenous women faced a similar position, and pregnant women of African descent, it has been found, are often subjected to state policing and surveillance and mandatory reporting requirements in relation to suspicions of drug use, because racism that is embedded within the health system and a harmful narrative about Black maternal unfitness also affects this situation. Apart from these identification of challenges, the way forward. So the Working Group on Discrimination Against Women and Girls has called member states and international bodies to implement an intersectional, feminist, and human rights-based approach to their drug policy responses, grounded in international human rights law and standards, with a comprehensive, restorative, and reintegrative justice approach. We also have approached this through the emphasis of the UN System Common Position on Drug Policy that views these issues not as criminal matters, but that sets forth that they should be addressed as a health issue to be dealt with through rights-based measures, including in public education, provision of mental hygiene treatment, care and support, rehabilitation and transition and reintegration programs. States and international bodies, in the second place, should also integrate the international guidelines on human rights and drug policy into policies that are relevant to women, and ensure that drug policies are gender responsive while upholding and actively seeking to protect human rights and fundamental freedoms. Effective community-based, inclusive, and preventive measures are also equally important. And I would add here an additional point that is not directly from the working group, but in which one of our previous working group members participated, that are the 8 March principles of the International Commission of Jurists, an NGO, that has developed together with different experts these principles that are based on human rights approaches to drug use and the related policy, to homelessness, to poverty, particularly affecting women and girls. So I would also recommend to view those as a relevant source for formulating policies. To conclude, we have a historical responsibility to reverse the devastation brought about by decades of a global war on drugs and its disproportionate impact on women. Now, more than ever, we must replace punishment with support and promote policies that respect, protect, and fulfill the human rights of all women and girls. Thank you again to the organizers, and I wish you a very fruitful rest of the event, and hopefully that this can benefit women and girls worldwide with the adoption of different kinds of more humane and intersectional policies. Thank you very much.
With building airports, with mega projects, with taking over the ports, and they're being given many civilian duties to be able to hold those spaces. And as we know, once you begin militarizing, it's much harder to pull back from that to a civil government. And so, and we see, you know, increased human rights violations under a militarized approach to life. So whether that's being stopped at a checkpoint, whether that's walking through the streets, and whether that's just any sort of interaction with the government and with the military in those functions. So in Instituto RIA, our vision around a feminist approach comes not from academia. It comes from homes, from classrooms, from the streets, from what we hear and see and live in marches. We believe that a feminist approach also begins to address the intersection between capitalism, racism, and xenophobia, and how do we work together as a team to begin to weave this intersectional approach against those structural conditions. We also believe that our approach within the organization and towards the outer world is based in lived experience. As women, as there are women who are migrants on the team, all of us identify as people who use drugs, as women who use drugs, as mothers, as caretakers, And that this really means that we have then that lived experience, but also recognizing that there are always gaps because we can't speak on behalf of all women and all experiences. And so recognizing that, I live in Mexico, I'm a white woman, and that carries privilege with it. So I can speak out as a woman who uses drugs, and recognizing that privilege and oppression that lives in our everyday life. And then figuring out how do we fill those gaps, and understand the multitude and diversity of experiences. And feel free to break me because I didn't make a presentation to know my minutes. So you, Gloria, you've got me. So one of the things that we really work on, so that's kind of the context. Some of the things that we work on is in Spanish, we have gendered language, right? So you have equipo, that's team. So in our work, we are 5 women who work in Instituto RIA, and we're an equipa because we're all women. So we can change our language to reflect the work that we're doing and who we are within our team. We've made the decision to incorporate menstruation days. See, if you are a person who's menstruating and you need time to be able to rest and take care of yourself, that's important. So both self-care and collective care. How do we care for each other together? Because we recognize that this work, there's high burnout. It's hard. We're dealing with stories that are difficult. I mean, just listening to the CND is hard. And then, we've all gone to the bathroom at least once, probably in the CND, and cried because you're receiving all of this. We also have focused in the last 3 years on doing many campaigns around women and drug use, and women and cultivation of drugs, sexual practices and drugs. So probably 80% of the messages that we receive on social media are from women who are either planning on consuming, or women who are recently pregnant and who would like to know, how does it affect me? No, I use cannabis, and how will that affect me? Should I stop? Or I'm pregnant and I've suspended my use and I feel anxious and I want to know how I can move forward with this. So it's thinking about how do we provide resources, recognizing that what is not named, what is not studied, becomes invisibilized. And so we know that there's a lack of research on how drugs, what's the relationship of substances in women bodies, in female bodies versus male bodies. And so we know that as a small organization in Mexico, we can't fill that gap of research. But what we can do is gather stories and experiences and be able to share that anecdotally, understanding that this is a personal decision that a mother or a woman must make, whether she decides to consume or not during periods of pregnancy, and also periods of lactation, which can be quite extended nowadays. No, I breastfed my children until they were 2 years. The idea that I would stop consuming cannabis or other substances, but you make your choices and you build in, how do I work in a harm reduction approach in my own personal life? If we're taking care of our bodies and we're taking care of our minds, then our children and the people we care for will be better off. Because there is also this piece of, as how do we sometimes go beyond in this sacrificing as the woman figure? How do we go against that idea that we must sacrifice all in benefit of, the rest, and what that means? For us, the personal is political. We believe that it's important to make decisions based on how that will be politically seen. We also recognize, and we run a drug checking program, and we see the power dynamics when women and men together come to check their drugs, and who is deciding, oh yes, I bought this substance, and I'm making decisions about her consumption. So we recognize that this is not that we have to build in ways that women and dissidents can feel closer to those services, whether that's doing, and many of our colleagues do this, days where it's only women who can use the service, or finding certain materials that are going to reach those populations. So we know that how women use harm reduction and drug checking services is different than men. For us, this is not a lateral issue. It's rather something that we've incorporated fully in our work without thinking about, this is our campaign on feminism. And so part of that has also been the research that we're currently doing, which will be an attention model for women who use drugs, which is being asked by the National Institute of Women in Mexico. And they know that we're coming at this from a harm reduction, not only abstinence approach. How can we really reach women? How can we speak with women as women who use drugs, as peers, understanding that what we're doing really has behind it the idea that we want to make life better for all women? Because in our proposals and our policy proposals, we are taking this approach of it's not about creating equality. It's more about shifting the balances of power. And so we advocate for the regulation of drugs because we believe that democratizes access. Then you don't have to go through power dynamics in order to access the substance you might want to have. And this is important because then a woman can decide when and where and with whom and how much. And the other thing is that for us, it's been a little bit troubling, and I'll close here, this term narcofeminismo or narcofeminism, because for us, it's really a word that we're trying to push out in Latin America. So when you speak to people from Latin America and say, narcofeminists, then it's this idea that we're actually connecting ourselves with non-state actors. And really what we're trying to do is begin to disintegrate those actors and understand that really the state has been much more connected with this idea of narco than us as activists, as advocates, as people in the streets. Because as we say in all of the marches, alive they took them, alive we want them. Thank you.
Thank you so much, Zara, for articulating so well the layers, the complexities, and thank you for the strength and resilience, and for still being here and still fighting. Yeah, it's wonderful and inspiring to hear from you and the work that you and your peers work on in Mexico. Thank you for sharing about the perspective there. And onto a different part of the world. So inviting baby Aya to share about her experiences working in Indonesia. Thank you, Aya.
Yeah. I will move a little bit. No, it's okay. Oh yeah. Okay. Yeah. Good morning, everyone. Thank you so much, Gloria. Thank you also for Marie and the other speakers, Zara, Alison. This is actually an honor for me. This is because this is my first CND, and I never think that we can speak about women issues are like this. So yeah, I really excited actually to come, not because of only the CND, but because I can bring my voice to the other part of the world that what we are doing, what we are experiencing as a women who use drugs. It's so we need to come up with the voice, not just shut up. You just to listen to your partner or to your even to your parents. Yeah. So thank you so much for inviting me to this panel. Yeah. So what I want to share here is my experience, is my lived experience. Actually, I come up with some other female and trans women who using drugs friends. Our base in Bogor. Bogor is one of city in West Java, Indonesia. So yeah, why we use the X in word of women is because our acknowledge to the trans women friends who using drugs are also our friends, are also women. So that's why we are using women's voice and to replace A into X. That's I just want to disclaimer first before anybody got confused about why you should put X on the women. Yeah. So this is a little bit introduction about who we are. Women's Voice actually our movement is powered by Suara Perempuan Lingkar Nafsa Nusantara Foundation. This is our organization that just got our legal entity on 2022. So we are very newbie here, but with all the experience that we faced, now we sit together and believe the transformation of power that we need to sit and self commitment to the other one, and so now we are there are 18 member active for women and trans women who using drugs, but for staffing, like Zara said, for staff only for 3 women. Yeah, because it is very challenging to survive with what our work actually. So me and my colleague there's a Rosma, and the other one who cannot join here, but yeah, we do sit together and thinking what exactly what we need, right? What exactly what we want, what exactly that we want to tell to the others. Yeah. So yeah, this is actually Women's Voice first built as a collective on 2022. There's 6 women and trans women who using drugs in Greater Jakarta area, and we decided that we need to build something, because for me, like I'm joining in the harm reduction program and HIV program in Indonesia since 2005, but it failed me out because many times we are trying to build a group of women who using drugs that's come up with it's a failed. We just dismiss all the meetings, and we just too busy with our domestic work, right? So yeah, this is me, Rosma, and the other one who think that if we not make more power to ourselves, how can we tell the world what we want, what do exactly what we need? Because like Zara said, all the policy is male policy, it's not female policy, right? So yeah, to have the power of supportive network that we think to break all barriers that women and trans women especially, because I think also this is quite happening globally, the issues of trans women who using drugs, right? Also in Indonesia, in Southeast Asia, trans women who using drugs are very, very struggling with their lives. Also, trans women who sex worker and using drugs, it's also very double, triple layer about that. So yeah, for breaking the barriers, we built the bonds of our community. Not always, not just to sit together to talking, but yeah, we are trying to make ourselves more knowledge, more have power. So we are following some trainings, and we share to other network and to collaborate and to make ourselves growth actually. So that's what we are thinking we should have, because all the decades are making women not seen, right? So yeah, this is I will grab this opportunity right now, because this is I will not say this is our time, but there will be no other time. Yeah, you should take it right now, right? So yeah, on what we believe that why I'm so honored to be in this panel, because this panel is acknowledge the feminist approach is one of the right approach for taking care about the women and trans women who are using drugs. So what we are doing in Women's Voice, we are trying to engage with other organizations, with other issues, also marginalized people, so with disability organization, with LGBTIQ organization, also with harm reduction organization, with legal aid, with media, and we are trying to sit together as a friend, actually, as a friendship, uh, not always, not just always to tell like what do we want from you, but what can I give you to know about us, so you can, maybe you can give your support to us. So yeah, what the experience from Women's Voice, actually, since 2021, we are trying to sit together with other organizations, with other issues, and trying to discuss about our problems through their lens, through their focus of work. So how we can come up with some ideas, some joint work to have a better future for women and trans women who are using drugs. Because when we sit together with other organizations, with other focusing of work, they all acknowledge everybody are using drugs. Yeah, even though with the prescription from doctor, there is drugs. So why should we not, why should we always ignore about that? And the women, and especially for trans women who are using drugs issues, they're having more layer of violence. Even though me and my other friends, we are most of us are living with HIV, also formerly incarceration women, single mom. So like, well, yeah, what Zara said is totally correct, that when we can decide it to be ourselves, yeah. So what we are trying to have, oops, I can not work, Maria. Sorry, maybe you can help. Yeah, Women's Voice are together with a network of Indonesian drug policy reform. It is a network from all community of people who using drugs. Not all the people who using drugs, but we gather the legal aid, the feminist organization in Indonesia, and we build some advocacy video. Actually, what we are hoping to come up with the idea to support, to have a better policy for women and trans women who using drugs.
Gue berharap isu ini bisa dibawa dan dikemas dengan baik oleh teman-teman yang nanti akan berangkat, supaya isu ini terdengar dan akhirnya bisa dapat satu hasil yang nyata untuk mengatasi masalah penggunaan nafsa di Indonesia. Itu aja. Selamat berjuang teman-teman.
Jangan lelah untuk memperjuangkan teman-teman pengguna nafsa di Indonesia untuk mendapatkan hak-haknya, termasuk dari layanan bantuan hukum, rehabilitasi khusus perempuan dan transpuan, dan kebijakan yang humanis bagi perempuan ketika mereka berhadapan dengan hukum, pembedaan pemenjaraan dan perlakuan terhadap tersangka kasus narkotika, khususnya perempuan dan transpuan. Terima kasih.
Semoga perempuan pengguna nafsa tetap konsisten dan komitmen, serta spesifik memperjuangkan hak-hak pengguna nafsa khususnya yang perempuan untuk menghilangkan pelanggaran HAM dan kekerasan berbasis gender khususnya untuk perempuan pengguna nafsa.
Saya berharap reformasi kebijakan narkotika di Indonesia sudah mulai menunjukkan arah keberpihakannya kepada mereka yang memiliki kerentanan ganda seperti perempuan. Karena sudah saatnya kita menghapus stigma bahwa perempuan pengguna nafsa adalah mereka orang-orang yang nakal, mereka orang-orang yang tidak sesuai dengan standar masyarakat, orang-orang yang tidak layak hidupnya. Tapi kita harus mulai melihat bahwa dalam regulasi penanganan kasus-kasus narkotika ada masalah yang lebih luas, di mana Negara harusnya menjamin akses terhadap keadilan, akses terhadap ruang-ruang peradilan yang adil, kemudian juga ruang-ruang pemulihan dan rehabilitasi yang mementingkan dan juga melihat kebutuhan khusus perempuan sebagai korban ataupun pelaku pengguna narkotika. Karena banyak juga kasus-kasus perempuan terlibat nafsa adalah mereka yang terjebak sebagai korban seperti dalam kasus-kasus tindak pidana perdagangan orang.
Saya berharap adanya reformasi kebijakan narkotika yang berperspektif gender dan dapat memenuhi kebutuhan perempuan pengguna nafsa agar tidak terjadi kekerasan pada perempuan pengguna nafsa.
Saya berharap reformasi kebijakan narkotika di Indonesia bisa lebih inklusif gender dan juga berbasis hak asasi manusia, sehingga tidak ada lagi stigma dan diskriminasi yang terjadi.
Sudah saatnya negara bertanggung jawab atas pemenuhan hak-hak dari perempuan pengguna nafsa. Salah satunya yakni dengan memperhatikan kebijakan-kebijakan narkotika yang ada di Indonesia dan mengusahakan agar kebijakan narkotika di Indonesia berperspektif terhadap gender.
Ya, harapan saya untuk perempuan pengguna nafsa di Indonesia dalam reformasi kebijakan narkotika terwujudnya kebijakan atau peraturan perundang-undangan tentang narkotika di Indonesia yang lebih menyasar kebutuhan khusus setiap individu, khususnya perempuan, dengan segala macam kebutuhan dan layanan bagi perempuan.
Kami berharap kertas kebijakan ini mampu membawa perubahan kebijakan narkotika yang lebih memihak kepada perempuan dan juga transpuan yang menggunakan narkotika. Terima kasih.
Ini suara saya untuk perempuan pengguna nafsa di Indonesia.
Yes, thank you for seeing our short video. But what I want to highlight before my time is running out, also how feminism could support push for responses centered into women who using drugs by uplifting feminist alternative actually and vision to the criminalization of people who using drugs, because as we know, like we are women, we are a partner, we are a mother. We should this entails dedicating resources to the prevention, also treatment and rehabilitation initiative, but while also enhancing social support system. Actually, that's what we are really need. And for individual, for like me and the other friends who grappling with our substance use disorder or addiction, we should make this feminist movement into drug policy movement actually. So because for me, and I think for all the women and trans women out there who using drugs, women who use drugs rights is human rights. Thank you.
Thanks so much, Aya. Yeah. And I think particularly, kind of admire I think the intersectional nature of your work and how both you and Zara like really always consistently always highlight the intersectional identities of women and always reaching out to find, not necessarily to find, but like acknowledging the needs of women who come from different backgrounds, different affected, I don't know, sorry, I'm not very articulate. Not articulate yet. I haven't had enough coffee yet. No, but thank you for also showing your refusal to leave people behind and to bring them along with you. Thank you, Aya. Last but not least, thank you, Alison Crockett. So Alison Crockett is from the Whole Systems Unit in the Drug Policy Division in the Scottish Government. Yeah, so there's very few governments that adopt a feminist approach to policies, and the Scottish Government is one of them, including for drug policy. So Alison, look forward to your sharing on this. Thank you.
Thank you very much. Very powerful orators and a wonderful PowerPoint presentation. I feel like I'm going to have to up my game somewhat from this a bit, but anyway, here you go. And thank you for saying that Scotland and we're trying, but I have to say You know, my presentation is going to say a little bit about the journey and the fact that, you know, that we still have a long way to go. And I think most of us still have a long way to go in achieving really properly feminist perspective in their policies of all sorts, as you say, but particularly in drugs policy. So, yeah, good morning. Thank you for inviting me to this side event and focusing on feminist perspectives. And delivering drug services that are gender sensitive and take the specific needs of women into account. As has already been said, I am from the Scottish Government. For those of you who don't know, that's the devolved administration of the UK Government. For some years now, we've been persuaded of the need to start to shift drug policy from the criminal justice perspective to one that embeds human rights in a public health approach. But as I've just said, we've still got a long way to go. Oops, including with my laptop. We've got a long way to go. So what I'm going to do is talk a little bit about where we've come from and what we're doing now to try to address some of the issues that we have encountered. Scotland, if you don't know, has the worst drug death incidence in Europe, and since our national mission was launched in 2021 with a vision to reduce drug death and improve the lives of people who use drugs, we have rooted our policy soundly in the public health arena. We've already heard very eloquently from the women on either side of me about the stigma that drug use brings to women, even more than their male counterparts. And Scotland is exactly the same. The women's role in societies often being carers means that they're often characterised not only as criminal but negligent and or abusive if they use drugs. And the damage is often highlighted of what they may be doing to other people as opposed to what they might do to themselves. Women find it very difficult to come forward for support in their drug use if they're also mothers, for fear of having their children removed, which is not an irrational fear, because the fact is that you are many times more likely to lose your children to social services in Scotland if you have substance use issues than you are if you don't. But as you've both also highlighted, it's not just women who are mothers who have been failed by our system in Scotland over time. Our last drug strategy, Rights, Respect and Recovery, contained only 9 references to women, and they were only mentioned specifically in relation to their being mothers, pregnant or dead, and leaving children behind. So we've since started to acknowledge that environmental differences that shape women's experiences, such as mental health care provision, housing, homelessness, income insecurity, experience of violence and other abuse, all of these things need to be addressed with a gender-sensitive lens. We acknowledge the need to expand our definitions and give consideration to women from ethnic communities, as lesbian, gay, bisexual, transgender, transsexual women, and women with disabilities, all of whom need our active attention to facilitate their participation in our healthcare. We've recognised the need to include the communities of women who use drugs in the design and delivery of our services, and to ensuring that they have the opportunities to meaningfully participate. Some examples then of this that we're starting to intervene with are as follows. The Simon community in Glasgow has a crisis accommodation unit in Glasgow, and it's a great example of women-specific service, including their By My Side app, which you can look at on your phones at some point. I think it's really great. It's designed by the women who use it and provides easy access to information on reducing drug harms, on mental health, sexual health, and support for women affected by violence. The accommodation follows a high tolerance housing model, which acknowledges the fact that many women using service also use drugs, and they've created safe space so that they no longer have to hide. Using this model, the Simon community has reduced the number of overdose deaths in their service from 16 in 1 year to one the next, by meeting immediate health and social care needs. And excuse me. So my visits there have often been moved by the compassion and the care that the women there show each other, and they look after each other, as well as finding the courage to continue to demand their own support. The Scottish Government workforce team are supporting local areas to consider the specific needs of women, not only in developing services, but also in growing the drug and alcohol workforce. Access to training around women's specific needs, such as stigma, women's rights, holistic care, sexual and domestic abuse, sexual and reproductive health, bloodborne viruses, neurodiversity in women, all kinds of training like that, all being offered now to existing and potential workforce to try and ensure that they have the skills they need to respond sensitively to people's requests for support. Excuse me. We're also looking to increase support to women who use substances in their infants during pre-pregnancy, pregnancy, and the early years. In recent years, an expansion of perinatal mental health support across Scotland, but as often is the case for women who use drugs, that's still there is still gaps in the service provision there, and we need to address that as a matter of some urgency. This piece of work that we're doing now will focus not only on keeping families together, but on supporting women who have had their children removed, because they often lose their support once they lose their children, which is doubly tragic. Equity of access to residential rehab has been an issue for us. Whilst we've provided around 9 million to the mother and baby units in Aberlour and Phoenix Futures in Scotland, it represents a small number of placements and restricts options for women with children who may want to avail themselves of that opportunity. So we're now continuing to explore how different models of residential care could serve women better. There's an increasing number of good examples of recovery groups that are specific to women. These groups create a safe environment where women who are often experiencing multiple disadvantage can come together and develop a sense of community. These groups highlight the importance of female friendships and are often vital support for women who are in various stages of recovery. Important to note here that these are high tolerance spaces and that women who use drugs are also welcome. A new Connect Hub has been developed by a women's group who will now have a completely separate space from the main access for those moments when they need it. The build of our safer drug consumption facility in Glasgow has been co-designed by a women's group, and they continue to oversee, I believe, rather vociferously, the design and the build to ensure that it will be a safe space for women to use. It's not perfect, and some women have still expressed concern that they won't be able to use it, but every effort is being made to minimise the barriers. Beyond women-only services, I think more needs to be done to ensure that women are considered at the earliest point in the design and the delivery of more generic services too, as you'll be unsurprised to learn as the head of the whole systems unit. As with most countries, drug-related harms and death are closely linked to a number of environmental factors. I've used this statistic many times because I think it's the most important one in our library. You are 15 times more likely to die of a drug overdose in Scotland if you live in the poorest areas than you are if you live in the wealthiest. 20 times more likely to lose your children in those areas. We're working with the whole systems unit on a raft of initiatives to promote the need for person-centred, trauma-informed service provision that will give women back the agency to demand and receive the help they need in the order that they need it. The very many women drug users, including the ones that are sitting here today, I've had the pleasure and the privilege to work with, and some of whom I've called friends over the years, are often strong, resilient, creative people who have had to deal with much more than their fair share of stigma, abuse, and punishment. Given the right support, they are absolutely able to articulate their needs, care for themselves and each other, and remain fully committed contributors to our communities. What they need is the health and care support that that should be the right of anyone in our society, and for us to get out of their way.
Yeah. Thanks so much, Alison. Yeah, I think it's so wonderful and refreshing to hear from a government representative about how much you see the challenges and the difficulties faced, and how much is needed to be done, and how the work that you've already started to do already, and the really significant results that you're seeing already, particularly in preventing overdose deaths, for example. So thank you, Alison. We need to end in, I think, 2 minutes or so, but I don't know if there's any questions people really like to ask, or I'm sure they probably are speak. Oh, okay, yes.
I'm Scholar Reyes. I'm from the Philippines. It's not really a question, it's a comment. I'd just like to add that in my country, for the past 6 years, from 2016 to 2022, when we had the authoritarian government of Duterte, that led to the killing of about 30,000 people. But of course, the government has downplayed that to about 6,000, and women, and of course, those who were orphaned will be like 6 people to 1 drug suspect killed. And what my organization is doing, which is Baigani, or Feminist Solidarity Against EJKs, is to give support to the women and to the orphans. And I'd like to invite you. We'll have a session tomorrow at 2:15. It's about extrajudicial killings, and we will have as keynote speaker the woman senator who was jailed by Duterte for her criticism on his drug war policy. And I'll be sharing what women's groups are doing for this orphans, and it's Women's Month, so I think it's the best time to do it. Thank you very much, and thank you to all the speakers.
Thank you very much, and thank you for your courage too in speaking out. So just final round of applause. Did you want to add something?
I just want to make one quick commercial as well, is that tomorrow at 4 today at 4 p.m. in the Vic Bar, we're just having a gathering of women with an X and dissidents that would just like to come together, and there's no agenda yet. We'll create the agenda when we get there, just so we can, across regions, across topics, be able to have conversations. So 4 p.m. in the Vic Bar today. Feel free to invite any women and dissidents that are at the CND, because yeah. Okay. Thank you, Gloria.
Thanks so much,
Thank you,
Sarah.
IDPC.
Thank you, everyone. Okay, I think that concludes our side event for today. We need to make way for the next side event, I think. Yeah, so thank you, everyone. Thank you to all of you.